Okay, well, my phone says 2 o'clock, so I'm going to get us started. But welcome, everyone. My name is Christina Kind. I am a program director at the Tahoe Truckee Community Foundation. Thanks so much for attending today's community belonging training. I am curious how many joined us for the first session. Today is the second session in our series, and so maybe if you could just raise your hand using the chat feature or in the window, or do a thumbs up, whatever emoji you want, to just indicate you were at the first training. Or turn your camera on. Yeah. Okay, I'm seeing some thumbs up.
I see a few hands.
Okay, and it's okay if you weren't. Dr. Herbert will go into that in a little bit. We do make the recording available. We do have the recording from the first session, but just want to start. I know it's a heavy week. A lot of people are experiencing some intense emotions, and so this training feels like the right place to show up today. And I just want to acknowledge all of you for showing up, and thank you for being here. Maybe do you mind changing the slide? Next slide, please. Thank you. So today's program will be offered in both English and Spanish. So thank you, Sandra, for interpreting for us. If you prefer to listen to today's program in English, you don't have to do anything. And just a few quick things when we talk about doing English and Spanish translation is that we can hear everyone in the main broadcast channel. All questions asked in Spanish will be translated into English. In addition, we do have live transcript, which allows you to see transcript in English and Spanish, although my understanding is it does not work on a cell phone. We try to pause in between slides to let Sandra catch up in the interpretation. And so we do ask if you are making a comment or a question today to also try to pause so that Sandra can keep up. And I'm going to take that lesson and slow down. And do we have slides in both English and Spanish today?
We do for the majority of our presentation. At the very end, we'll say to monolingual English.
Great. So if you will see at the top of your screen here, one little bubble that will say Maeve Donovan's screen. That is how you view the slides in English. You'll see another little bubble that says Ver las diapositivas in Espanol, and that is how you'll view the slides in Spanish. So if anyone is not viewing them in their preferred language, just look for that banner at the top of your screen and you should be able to navigate to Maeve to view the slides in English. So thanks. So before we introduce today's trainers, I wanted to give you a little bit of a background. Oop, and I lied. I said I was going to do the pre-survey and I didn't do it. So as I'm talking, if you could please take the pre-survey. I just dropped the link into the chat box. I will try to keep dropping the link in for those joining us later, but it's helpful for us to understand how to curate these more meaningful to you as a participant moving forward. So thanks for your time in taking the survey. I'm sorry to interrupt. Please,
want to add, please take the survey. During our in-person meeting, our training 4 and our DEI action planning, I will be doing a raffle. So from those who took the survey, there'll be a raffle. So yeah, please do it. You might win something in January.
Thanks, Dr. Herbert. That's a great incentive. So our mission is to bring together trusted partners to align strategies and inspire philanthropy to nurture a resilient community and environment. Next slide, please. We do this through grant making to nonprofits, scholarships to high school students and our workforce, as well as focusing special attention on our community's well-being, force health, and housing needs. And Deirdre, I see that your hand is up. Did you have a question, or is that just up from before? I'm going to keep going. Oh, I think it was up from before. Thanks for taking it down. Next slide, please. We are led by a visionary board of directors who are deeply engaged in our community. Do we have any of our board members joining us today? I'm not sure that we do, but thank you so much for your leadership. And we're joined by a very talented team. Joining me today from the Tahoe Truckee Community Foundation, in addition to Maeve Donovan, who is our program manager, are my colleagues Phyllis McCann and Parisa Nodehi. So the Community Foundation has been on its own learning journey in this space. In 2020, our board came together to ensure that our mission and work are driven by equity, with a focus on redistributing power and resources to dismantle racism. We set out to go beyond a value statement, which you can see here on my screen, by creating a comprehensive learning journey for both our board and our staff. We've aligned these efforts with the Community Collaborative of Tahoe Truckee, which many of you are partners and are here joining us today, which is a program of the Community Foundation to explore how TTCF can truly lead, engage, and provide value to the broader community. So this has been essential to moving from statements to action in a meaningful way. So led by our board members, Erin Kilmer-Neal and Emily Gendron, and CCTT's former director, Allison Schwedner, our learning journey really set the foundation for our work today. We've worked closely with nonprofit partners, giving them tools, frameworks, much like we're going to do today, facilitation guides, and practical steps to spark meaningful conversations. This journey has also pushed us to understand systematic structures of racism and inequality, leading us to partnerships like the Barracuda Championship PGA Tour golf tournament. And you can switch the slide, Maeve. To make a broader impact in our community. They've funded initiatives like our Spanish language interpretation and leadership training and this community belonging series. So today our focus is on deepening our collective understanding of equity through data. Our main goal today is to really foster a safe space for this learning. And we cannot do this work alone and are so excited to bring Dr. Leah Herbert and Dr. Galaxina Wright, all the way from Florida, who are here to be our guides for the next 2 hours. And so with gratitude, I am now going to turn it over to Dr. Herbert. And Dr. Herbert, please lead us.
Thank you so much, Krista. Okay, awesome. I see the slides. Thank you so much. It's so great to see everyone today. We're really excited. For today, we'll be diving into the essential topic of how disaggregated data and data justice can help our organizations create equitable outcomes. We'll explore ways to better understand data in our communities and to understand needs that otherwise might go unseen, especially in rural, mountain town, and Latinx communities. So we'll briefly introduce ourselves as well, since we have some new faces on the call today. So my name is Dr. Leah Herbert. I've been in the equity and inclusion space for many years. I'm also a senior inclusive researcher as well. So I love all things data. And I am more than excited to be sharing and teaching today, but also to be teaching in our follow-up office hours, which will be December 7th, and we hope to see you there. I'll be your guide today alongside my amazing colleague, Dr. Galaxina Wright. I'll let her introduce herself a little bit since we have some new faces right now.
Hi, everyone. I'm Dr. Galaxina Wright. It's nice to meet everyone. If you see a little hand in the screen, that is my daughter, who I should be passing off to my husband in just a few moments here. So it's nice to meet everyone. I'm an assistant professor at Nova Southeastern University in Fort Lauderdale, Florida. I also am a licensed mental health counselor, as well as have provided trainings before in diversity, equity, and inclusion. And I'm so excited to be here and to walk alongside with Dr. Herbert.
Awesome, awesome. And Dr. Wright also does really awesome conferences and teaching presentations and nationally across the country. And we're hoping, fingers crossed, for internationally. So she's just an inspiration and wealth of knowledge. And I'm really grateful to have her on this ride for today. So ultimately, walking through our goals and objectives for today, we're really hoping that you guys will have a clear understanding of what disaggregation, data disaggregation is, how to develop inclusive data strategies, and how to bring principles of equity into your data collection process, but also empowering your staff members, your colleagues, your friends and family, and understanding data a bit more. And these goals are really all about empowering you at the individual contributor level, but also impacting larger org as whole, board, executive leadership, and hopefully larger collective impact at the community level. Next slide. Awesome.
So one of the things that we've done with our groups and that we've continued to do is just basically the co-creation of group norms. Otherwise, basically some guidelines to kind of keep this space still safe for everyone, but also allowing time for people to share their truth. So the first, just going through them briefly, is to be mindful of airtime. Of course, we've got a short window here of only 2 hours, and that's a reminder to myself and Dr. Herbert as well, because everything we talk about today, we could talk about for hours and hours, but just being mindful of the time that we have and really making the most of the groups that we'll have later today. Being mindful of your truth is different from someone else's truth. And we see this a lot when we think about differences in communities and sub-communities. So being mindful of that when you're hearing other people share things. Also using I statements, so speaking on how you feel rather than on behalf of others, because oftentimes we might misconstrue this sometimes, and making sure that we're really focusing on ourselves. And then also just making sure that when sharing stories or sharing personal things, that we're being confidential of other people's information. So really just kind of sharing the lessons or the themes that you've learned from maybe different interactions rather than actually naming those individuals. And then of course we want to make sure that we gently disagree, but not disrespect. So making sure we're honoring each other's opinions and being respectful of one another in the differing opinions as well. And if there's any other rules that you feel like would be helpful for the space, please feel free to add them in the chat. Oh, Dr. Herbert, you're muted. I think you were trying to.
You. I was like, thank you so much. I was looking at the screen to see if I see any additional rules added to the chat. I also wanted to name, later on today, we'll talk about data sharing practices in the community and what are some helpful pieces to have. And a helpful piece that I like is also the co-creation of group norms. So even what we just did just now, I encourage you, add that in your presentation or your data set as we move into talking about inclusive communities. And that might be looking like a co-creation of norms. That might look like I accept every person here as equally intelligent, right? Community knowledge and inclusion is honored, right? We honor lived experience. We honor noticing who's included, who's excluded. So I think things like that are really great level setting. And we encourage you guys to use that in some of our future activities when we think about data sharing and impact in the community. So now we'll be moving into our learning segment. In this segment, we highly encourage you guys to take notes, to write down terms. This is the time to really dive in. Our presentation is both twofold, learning and application. And the application part, I will admit, will be a lot harder if some of the slides or some of the core elements you're not really writing down. So I encourage you to take out a book or take some notes as we're going along. So last time, a few familiar faces here remembers that we talked about a really core essential element of equitable best practices for community engagement, right? We talked about some core essential pieces of moving from more passive levels of engagement to more active levels of engagement. We talked about core elements of trust building, most importantly, understanding know, like, trust framework, and understanding elements related to trust takes time, it takes consistency, and really delving into that. I do want to name some pieces that we discussed and highlighted and just review them really quickly. The first one is the one below with the equality, equity, and justice. Understanding that framework can be tremendously important for the work to come in terms of outreach and engaging with the community. Understanding that people may fall at different mental models, right? My dad may really be invested and his frame of reference is truly equality. And then my reference is really justice. And my sister may be equity, right? Holding space for all those different mental models, but really having the strength to move towards justice with time, effort, and collaboration. The next piece I wanted to also highlight was our awesome community engagement spectrum. To the naked eye, community engagement is often seen in the form of outreach, support, or long-term collaborative interventions. This can take the form of arts activities, this can take the form of social and recreational events, or me and Dr. Wright's favorite, psychoeducation, where we'll feed you, we'll have a good time, but you're gonna learn something at the end of our community outreach, right? So I think a key piece that we really stressed in this framework model is that community engagement truly exists along a spectrum. Every element from informing, right, providing communities with balanced and objective information about programs and services and reasons for choosing them. At this level, communication looks like we're keeping you informed. And in terms of the tangibles, it might be fact sheets, newsletters, websites, and open houses, right? So put in the chat or put some emojis if you're familiar with those. Like if you've opened the mail and you've seen a fact sheet, or you've gone to a farmer's market and you've seen a newsletter given out, right? We're learning more about this organization in the community and what they do. And I might take a picture of my selfie and send it to Dr. Wright, right? And then the next step we have is consulting, inviting feedback on alternatives, analysis, and decisions related to new programs and services, right? So this one is a level up, and we think about the communication strategy being, we'll keep you informed, we're listening to feedback and getting more ideas on the concerns that are influencing the decisions. So now we're getting into some fun data, right? Surveys, focus groups, community meetings, forums. I would even go as far to add affiliate groups, right? Like TTCF and some other affiliate groups, things of that nature. Myself and Dr. Wright being a part of the affiliate group of the American Counseling Association, the American Psychological. All those are affiliate groups that you can get more information and learn a lot more about your individuals that are impacted by your service, right? Then we have involving, where we're really working with community members to ensure their aspirations and their concerns are considered at every stage of the program planning process and decision making. And this one sounds easy, but it's a bit more harder to do. We're really ensuring feedback, we're discussing alternatives, and we're making sure that we're engaging community members a little bit more closer as partners. So this might delve into some elements related to community organizing. And as Krista greatly mentioned, the element related to leadership development, right? So they talked about they recently had a leadership development workshop, right? That's getting really invested in that development phase, in that involving phase. The last two, collaborating and empowering, we're really working with community members as opposed to community members. In these stages, we're really working in terms of leading work to implement creative solutions. Professionals are also joining in. We are working with other community partners, we're working with youth, we're working with community leaders, and we're really invested in the voice of the community, being flexible, taking criticism even when it hurts. Myself and Dr. Wright have been at the outreach and community table where an event was not taking well. Intervention that got granted for 4 years, we did not like year one. So we have to go back to the drawing table. So things like that really open up the gates from a board perspective and executive perspective. How are your advisors? Oh, yes? Is there a comment? Sorry, did someone say something? I thought I heard something.
I don't think so. I think it's okay.
Okay, sorry.
Okay.
So the collaborating and empowering, we're involving community members, and we're also thinking about reflection of community. Is our community reflected in our boards, right? Are we using disaggregated data to look at our boards and see, are they reflecting our community? Are we doing that work with our advisory boards as well? Are we considering that in terms of leadership and future partnerships? So it's a really great framework. We'll definitely come back to it a few times. And this will be key in developing your organization's DEI action plan, which we'll be working on in January. By understanding these, you really can have really hard metrics and really hard spectrum goals that you can lead to, and you'll have a communication element tied to it. Awesome. So now we have a bit of a fun activity. I'm going to need everyone to use the chat. I would love to see some hand raises, but this is a really fun activity, and we're going to walk into actually a classic example to show why disaggregating data can be important. So I have a scenario for you guys. Imagine that you are choosing a hospital based on mortality rates. And we have here a table of two hospitals, Hospital A and Hospital B. We also have on the y-axis indices related to death, related to those that have survived, and related to the total amount. So we can see that Hospital A has its data, and we see Hospital B has its data. At first glance, the hospitals appear fairly similar, and we see the totals are different. But I'm going to pause here a little bit, and I want you guys to put in the chat, which hospital are you choosing? So take your time. We'll give you guys like a minute or so. Okay. And feel free to put Y as well if you want to. Okay, I see B, a lower percentage of death. Interesting. I see A. Okay. I wonder if there's some. Okay, okay. I like what I'm seeing. I like what I'm seeing.
So far, it's about half and half, it looks like, between half A's and half B's.
Okay, Jennifer, I love your point. We need to do more learning before making a decision. That's a really good point. That's a really good point. But just in this hypothetical element, if you had to choose. Okay, okay. Well, thanks. I see it's 50-50. I also see some people that would choose option NA. I will not be choosing a hospital today, no matter how kindly you ask. But yeah, so, in choosing this, we're really looking deeply at these two hospitals and thinking through it. By these two different elements, it's important to know that when we move to the next slide, we see some interesting pieces. Now, we know from the two hospitals just on face value that Hospital A has a 3% in terms of its surgery patients, and Hospital B loses only 2%. And that's when we kind of compare the bottom to the top. But when we move to the disaggregated piece that we're seeing now in front of us, disaggregated, think of it almost like a meal we're having at a restaurant. And it's all the little ingredients that help us make sense of this Caesar salad or make sense of this pesto pasta. So when we dig more deeply and we get to learn more of the ingredients, it goes back to what Jennifer said. Dr. Herbert, thanks for this hypothetical, but I need more information. So when we disaggregate and we pull the data points out, we look at the patients with good condition and we look at the patients with bad condition. We have this interesting similar data points, the death, survival, and the total. And we see here that, Hospital A has its data, Hospital B, and then vice versa for patients in bad condition. I now want to put the same question to you. Are you going to the same hospital? Let's take a minute. Are you going to the same hospital? Okay, I see Sophia saying, no, I'll go to Hospital A. Okay. Okay, I see Tammy, I'm going to Hospital A. Okay, awesome. Okay, okay. And this is what researchers mean when we say that data does not always give the full picture. We can have one set that on face value, right, it really looks like B is the way to go, things of that nature. And then when we kind of disaggregate and we're pulling patients maybe in good conditions, patients in not so good conditions, and we're able to compare, we get a lot more deeper example. Additionally, when we think about community outreach and inclusion in our data, this makes me pay attention to what you're talking about. Before, I'm kind of like, okay, survival rates and 2 hospitals. I don't really know how I feel about this. I know when I look at this, I'm like, oh, wow, which one do I fall in? Which one would I choose for my dad? Which one would I choose for my mom? All these interesting pieces and questions and curiosities are coming to mind. And guess what? I'm walking up to your org and I'm like, I want to learn more. Can you sign me up? Do you guys have an information session? Things like this really show the power of disaggregated data. And this is a really fun example you'll usually see in your kind of advanced statistics class here and there around the importance of disaggregated data and a little bit of the element that data is just one part of the picture, right? It's the way in terms of how it's presented that can paint one thing, but when we break it down, we end up seeing some other interesting and fascinating factors. We can move to the next slide. Awesome. So speaking of, we just saw some interesting data related to community outcomes and things of that nature. And before moving forward and talking all fun things about disaggregated data and data justice, I wanted to kind of pause here and share a little bit about data capacity in terms of communities and things we can consider. I remember during our last training, we got an interesting comment that was related to communication, right? Like, Dr. Herbert, this is a good start, but what do we do when there's a bit of communication gap and we're not seeing some of those things? Well, the first element that I highly encourage individual contributors, organizations at large, board members, and executive leadership to always consider is enabling resources, access to data, and then access to help with data. Right? So access to data, we're thinking about our data sharing agreements, our open data platforms, public websites, and whole data sets. And we're also thinking about the way that we share data to community. So that might be fact sheets and that might be analysis on certain topics. But another piece that's really important to consider is access to help with data. And assistance can be technical workshops, it can be trainings, it could be one-on-one coaching, but access to help with data can also be explainer videos, can be written guidance, and also file documentation and naming. I actually recently worked with a nonprofit that was hoping to clean up and improve their data governance. And one of our key goals, and we could even write this later in our action plan, is improving the file documentation, right? How often are we looking for a survey or we're looking for a data set? We're like, oh my God, what do we name it? Where's the project? It's all over the place. And sometimes even breaking down of how we name our folders, how the folders are organized. Are we organized by sector area or our core projects or our core programs? So things like that can be incredibly helpful for enabling community data. Another piece that we should consider from an organizational perspective is curiosity culture, right? Are we using data as a tool for learning and innovation? Additionally, in terms of consideration for additional things that an organization can do, is also considering data routine, reviewing data early and often and guiding decisions to improve services. So in terms of some of my early work I've done in the past, some really big changes I've seen that's really helped orgs is even having, we have our bi-weekly meetings or our all hands meetings, we might say in certain IT circles. But having a data meeting either once a month or bi-weekly can be incredibly helpful and also give and empower program leads, outreach community workers, board members alike, and even volunteers, right? Who, with permissions and certain NDAs and everything signed, can really aid in that data collection and data routine process. And then at the community at large, we'll talk about this a little bit more. We can really encourage learning communities, cultivating relationships, not only with us as like the data collectors, but also the community at large, which may be the data users, and encourage new ways of thinking and data capacity. We can also greatly inform collective planning, right? As we come up to Q4 and we're really thinking, what does, maybe summer and winter look like for the year to come? We're really thinking about some of those core tools. And lastly, data sharing, right? Developing trust of sharing data within the bounds of protecting confidentiality. One of the resources that I have in you guys one pager is a really great read, and it's called Investing in Data Capacity for Community Change, a nonprofit guider. And it's such a good read in terms of really thinking through what this might look at the capacity building level from a community standpoint. So now we will hop into disaggregated data.
So
And
as
Dr. Herbert, can we, oh, sorry, can
go
we
ahead,
just
I'm sorry.
pause and just make sure, ask if
Sure,
anyone has questions?
sure.
Just make sure that,
We can go back if anyone has.
thanks. So I know that was kind of a lot. Just want to make sure nobody in the group has a question for you. Okay, thanks for letting me interrupt.
That's a good idea though, just do a pulse check, make sure,
Mhm.
just in case. So if you guys do have questions throughout, definitely put them in the chat, and we'll make sure to address them out loud as well.
Yeah, in the
So,
chat, raise your hand.
yes.
You're all ears.
So
So,
as Dr. Herbert shared earlier about disaggregated data, when we talk about disaggregated data, what we're referring to is basically breaking down a large data set into a smaller one. As you saw with the example with the hospital, we had larger data, and then she went to the next slide and it broke it down even further. So when we break down data sets even further, this helps to uncover trends or patterns, or maybe even some barriers that we're missing, that can sometimes be revealed.